Hello everyone, welcome to sqadia.com, and in the second section we will continue to talk about the ovarian cancers. In this section we will talk about some clinical features, diagnosis and interventions of ovarian cancer staging, and how we can manage the ovarian cancer. Clinical features of ovarian cancer, most of the time it can be non-specific symptoms, not very specific symptoms relating to ovarian cancer. So that's the reason mainly why in the early stage ovarian cancer is missed. And when it's diagnosed, it's already too late and it's spread already, and then recovery is not, or prognosis is not very good. So the one reason for that is non-specific symptoms, because patient doesn't complain any specific symptoms related to ovarian cancer. So that's why it is mostly diagnosed at the late stage. Some common symptoms, if they are present, is there is increased abdominal girth or bloating. Abdominal bloating is common. And then there is persistent abdominal and pelvic pain, difficulty eating and feeling full quickly. So mainly they feel bloated, and they don't feel like eating anything, and if they eat little, they feel full quickly. And then some other changes is irregular bleeding, backache is common, and then urinary symptoms, change in bowel habits are also common. Fatigue is common. So incontinence and change in bowel habits, if it's constipation, alternate period of off and on diarrhea. So this is the normal routine bowel habits are disturbed in the ovarian cancer. So in this diagram you see this is the normal ovary. That's how look like normal ovary, and this is the cancer. You can see the difference between the normal ovary and the ovary with the cancer. Then diagnosis is very important, is the transvaginal ultrasound is done. Then tumor markers. Tumor markers is the other important test done for diagnosis, like CA-125, which is elevated in the presence of ovarian carcinoma. Then CT scan, malignancy index, different MRI, magnetic resonance imaging is done. And then X-ray is good, ECG, full blood count, urea and electrolytes and LFTs. In these, some tests are very, very important to find out the spread of the ovarian cancer, if it's spread to the brain or kidneys, liver, heart. So all these are important tests done to find out the spread of the ovarian tumor beyond the ovaries or the abdomen. Then the staging of the ovarian cancer, according to International Federation of Gynae and Obstetrics, they stage it. Stage 1 is further subdivided into 1A, 1B, 1C, and then 2 is divided into 2A, B, C, and 3 is 3A, 3B, C, and 4 is very terminal stage. And then here, if you see in stage 1A, this is just in one ovary, early stage, stage 1A. And in this stage 1C, so from 1A, which is just involving the ovary, if it goes to 1C, you can see it also spread outside of the surface of the ovary. So from 1A to 1C, it spreads from inside to the outer surface of the ovary. Then in stage 2A, here you see it spreads all over beyond, reaching almost to the here fallopian tubes. And then stage 2C in this, from 2A, which is fallopian tube, in 2C it spreads also in the abdomen, here ascites. And once laparotomy is done to see inside how widespread this tumor is, you see the fluid inside the abdomen. And this is the 2C stage. And then in 2B stage cancer, it spread to the bowel and bladder also, here, bowel and bladder. So already in stage 2, it starts spreading beyond the ovaries. It involves fallopian tubes, it's involving bowel and bladder, and in 2C it is involving the abdomen also. And there is ascites. Ascites is the presence of fluid in the abdomen. So see the fluid in the abdomen. So this is stage 1 and stage 2. And then in stage 3, very again widespread, spread into the ovary, 3A, and then 3B, again it is spreading here into the vagina. In 3A also you can see it starts spreading outside the ovary. But in 3B it fully spread to the vagina here. And in 3C it spreads to the lymph nodes. These are the lymph nodes. And once lymph nodes are involved, then it's disseminated through the lymph nodes throughout the body, and then widespread metastasis takes place. So in the stage 3 it's already widespread, and when diagnosed, usually the prevention is not possible. Management of the ovarian cancer, we divide it into 2, preventive management and then curative management. In preventive, we prevent primary and secondary. Primary, which originating from the ovaries, we try to, like we already said before, there are some prophylactic measures we should take to prevent the cancer, like salpingo-oophorectomy, salpingectomy, and then putting on oral contraceptives, tubal ligation. These are some steps we can take to prevent the ovarian cancer. But curative, to cure the ovarian cancer, which is already present there, we do the surgery. Surgery is done. And then again, surgery is very carefully decided by the doctor whether surgery should be done or whether surgery is beneficial or not. So they do the laparotomy, open the abdomen, and check if the tumor is already widespread beyond the ovaries. Then usually the surgery is not very effective. But if it's in the early stage, limited to the ovaries or maybe little spread to the fallopian tube, they try to do the surgery and do the salpingo-oophorectomy that might limit the disease. So surgery is used to cure. Then chemotherapy is along with surgery is sometimes used, or alone chemotherapy with radiotherapy is used. Combined therapy is usually chemotherapy, combined chemotherapy or radiotherapy is tried for curative measures. Primary prevention for is ovarian cancer. We have genetic screening. Screening is done for BRCA1 and BRCA2, which are the common for ovarian breast carcinoma. So mutation in BRCA1 and BRCA2 leads to ovarian breast carcinoma. So screening for them is helpful in the prevention. Then mammographic screening is also helpful. Periodic screening to check the BRCA1 changes PRCA2 changes, and to find out the CA125 levels. This periodic off and on screening helps to find out any abnormality that can lead to ovarian cancer. Combine oral contraceptive pills and oophorectomy and hysterectomy again can be used to prevent the ovarian cancer. Now, some guidelines for management of enlarged ovary. If the ovary is larger than 8 centimeter, usually, especially during the reproductive time, this needs to be followed up very carefully. So, size of the ovary is important. So, whenever they do the ultrasound or gynecologists do the ultrasound, they keep on measuring the size of the ovary. If it's more than 8 centimeter diameter, then it should be followed up. Maybe it can lead to problems. But in post-menopausal women, after the menstruation stops, any ovarian should be by serum CA125 levels are used to measure to find out if there are chances of developing ovarian cancer or not, and then sonography or ultrasound is also performed. Cysts that are simple and less than 8 centimeter and normal serum CA125, usually these things can be managed conservatively and keep on following up is fine, but they don't need any aggressive treatment. If serum CA125 levels are normal and size of the ovaries is less than 8 centimeter. And then laparotomy in certain cases to find out if there is any abnormality or any spread or any problem with the ovaries. They just open the abdomen and see inside what's the condition of the ovaries. In secondary prevention, again, also screening procedures, which we mentioned early, to find out if there is any spread or any other problem or any other malignancy that have chances to spread to the ovaries, and genetic testing, in which again there is BRCA1 and 2 mutation is important to test. Now, what is the surgical treatment of the ovarian cancer? The aim of the surgical treatment of the ovarian cancer is to stage the disease. Very important staging. If to remove the sample and biopsy is done, and with the laparotomy, then they find out what is the staging of the ovarian cancer, at what stage the cancer is present, and if whether the surgery will be effective or other treatment measures should be adopted. Some practical guidelines for the surgery: vertical incision is given, not horizontal, it's vertical. And then they check for the ascitic fluid. Ascitic fluid is the fluid present in the abdomen, usually with the spread of the cancer to the abdomen. Then they explore the abdomen visually and manually, and then explore the pelvis and find out if there is any spread or the metastasis of the disease is present beyond the ovary to the other areas, or whether they can be cured or whether they should start other therapeutic measures. Primary surgery in early stage is divided. Surgery is basically divided depending on the stage of the cancer. In the early stage and then in the advanced stage, your treatment options are different. So in the early stage, when the cancer is in stage 1A and the cell cycle growth is in the G1 and G2, And in the young women, usually unilateral oophorectomy is preferred because if young, they usually want to have conception, they want to conceive. Later on, they want to try to conceive. Usually for the young female, it's better to try unilateral oophorectomy. One side ovary is removed. And then in the elderly, if the fertile time is over, they don't want any further family, then it's hysterectomy and bilateral salpingio-oophorectomy is recommended. In stage 1A, and the cell cycle stage G3, usually again staging laparotomy is done and hysterectomy and bilateral salpingio-oophorectomy is done. In the advanced stage of the ovarian cancer, usually cytoreductive surgery is performed, and then optimum cytoreductive surgery or maximum cytoreductive surgery. So they just try to, in the advanced stage, when usually the prognosis is not very good, they just try to reduce the number of the growing cell. So cytoreductive or debulking, or try to remove the spread or the cells from the areas instead of going for very extensive surgery. Now, some of the chemotherapy drugs which are used as a chemotherapeutic treatment of the ovarian cancer is in stage 1A, grade 1 epithelial carcinoma, usually no chemotherapy is used. In all other stage 1 disease, there is chemotherapy used, which is usually carboplatin, and paclitaxel for 6 cycles is used. And in advanced stages, usually the combined chemotherapy is used, and mostly the drugs which are used are cyclophosphamide, adriamycin, and cisplatin. So SCAP is used, cyclophosphamide, adriamycin, and cisplatin. They are used to treat in the advanced stage of the ovarian cancer. So in the stage 1A, usually no chemotherapy. In the later stages of 1, we use the 2 drugs, which is carboplatin and paclitaxel, and then combined chemotherapy is used for all the later stages, advanced stages, which is cyclophosphamide, adriamycin, and cisplatin. Then also along with the chemotherapy and cytoreductive therapy, there is other treatment measures which include radiotherapy, in which radiations are given to reduce the size of the tumor or to decrease the spread of the tumor. And then also immunotherapy. Immunotherapy is to decrease the immune response and decrease the spread of the cells. So immunotherapy. So these are also other options besides the chemotherapy. And then again, some other drugs are melphalan is used, cisplatin, carboplatin, and paclitaxel. These are some other drugs used for the treatment of the ovarian cancer. So this was section 2, in which we talked in detail about some clinical features, diagnosis, staging, and the management of the ovarian cancer. Thank you for watching sqadia.com.